Welcome back to the FARA interview series where we are taking you behind the scenes at the International Ataxia Research Conference. We are here with Dr. Kathy Mathews and Dr. Antoine Duquette, and we're going to talk about the natural history study and why it's so important. But first of all, Kathy, why don't you introduce yourself, and then we'll have Antoine introduce himself as well.
So I'm a pediatric neurologist. I'm at the University of Iowa, and I've been enrolling patients in the natural history study for about 15 years.
Nice, wow.
And I'm an adult neurologist at the University of Montreal, and I'll be enrolling my first patients 2 weeks from now.
All right.
That's great.
So for all of us in the U.S., you said Montreal, right?
Quebec, Canada.
All right, good.
Now, you guys are both involved in the Clinical Research Network in Friedreich Ataxia. Can you tell us a little bit about what that is? Give us an idea about how important that is.
So it's a growing group of neurologists across the country and soon the world who are enrolling patients and following them annually over time to determine what is the course of Friedreich ataxia.
That's referred to often as the natural history study?
Correct.
Okay.
And
Yeah, I think that's the core of the network. Brings together the clinical investigators and the design of the study. I think the network is actually also built to help design studies also and future clinical studies that would jump off from the natural history study.
To give guidance to our partners in industry as to how they can use the data that's gathered by physicians and clinicians like yourselves in helping us move some of these things through the pipeline, essentially.
I think there are a couple ways that it's helped. There are probably more, but at least two ways that it's helpful. One is that it has a group of sites that are trial ready. Mm-hmm. So a group of sites who have experience with Friedreich ataxia, are experienced in doing the outcome measures, and so they're ready to be to enroll patients in a treatment trial without a lot more training.
So when an industry partner wants to do a clinical trial, they know that they've got some institutional expertise, people who know their way around FA, essentially.
Bingo.
Okay, what was the second?
And the second is that the understanding the course of the disease allows industry to design a trial. So they can't know how many patients do I need to enroll to change this outcome unless they know how rapidly does that outcome change without treatment. And that is hugely important. Mm-hmm. And then I guess the third thing, and then I'll let you jump in, is that it gets the patients engaged.
Yeah.
And that's hugely important. So when patients are engaged, then they are also ready to join a clinical trial when one's available.
Yeah. There's a place to go to take action, so people can get involved and take the action that they need to. Yeah.
Right.
Yeah.
Love it.
And I can't stress enough the importance of your first point, because it had been several years since there hadn't been any clinical trials in Canada, and there are, just in the province of Quebec, probably more than 200 patients, and there were no trials. And
wow.
And since I'm part of the network, there's a lot of interest. And patients are asking for trials. So that will make a huge difference for our patients and certainly for future sites.
And do you think that clinical trial interest comes from like the site readiness, the knowledge about FA, the natural history study, or is there something else on top of that?
Well, that's what Kathy said is certainly a factor. The industry knows that the sites are ready and they're used to seeing and evaluating those patients, so the sites will be reliable. But also, the natural history study gives each and every site, not a registry of patients, but when the industry comes with a trial, they have a list of criteria, and it certainly helps to say, well, we have maybe 20, 25 patients who could be, eligible. So for them, it makes sense to invest and select a site.
So a patient comes in to see you, and what do? They do like the finger to nose thing, and they do the vision board, and they tell you how many, and they try and stand on one foot and all that, right? Is that kind of
You've
what
done
it is?
You've done it a lot of times, Kyle. I've seen
so,
you be a sample patient to instruct people in how to do it.
So I'm just saying that, it's such a tangible way for patients to push research forward. Like, we all feel so powerless, but then, like, all of a sudden there's this way that we can get directly involved with and it doesn't happen without us. Like, I just think that's a really powerful thing.
And it is so important. I think people sometimes feel like, if I'm not taking a drug, I'm not advancing the field. But this is hugely important. You cannot design a drug trial unless we have this information.
Yep.
So it is enormously important. And then one other thing that's important about it is that I think it helps to inform care. That through collecting data on a huge number of patients, even before we do a drug trial, we learn more about the disease and the details of the disease and how it varies across people, and it allows us to help to start to design, to know how to proactively care for people better even before we have a treatment trial.
Yeah.
So
Wonderful.
It strikes me this is so typically FARA, to have a thing that everybody gets a benefit from, that the patients, the folks with FA can come in, they can feel the affirmative change of doing something on their own behalf, that clinicians like yourself get a benefit from it, that the scientists have the data to work from, that the industry partners get something out of it. It's just bringing everybody together to, find a cure.
Yeah.
Which is beautiful.
and the foresight of FARA to start this 20 years ago was
brilliant.
brilliant.
Good point. Yeah.
Let me ask you this. My guess is that everybody watching these videos probably has already participated in the network and the natural history study. But if there's someone out there who hasn't, what's your advice to them about how and whether they should be involved in this?
Oh, they should certainly be be involved.
I knew that was the answer, by the way.
and I think that the study also needs patients from early on to later in the disease for us to really understand the disease. So people should certainly get involved, and they should probably, I don't know, for what.
On our website, www.curefa.org.
Yeah.
All right.
Cool.
Well, thank you both so much. It's been a real pleasure. We appreciate this. I know that our audience at home appreciates this. Our next video is coming up. We're going to be interviewing some of our FARA researchers regarding frataxin, the protein at the base of all this, and how and whether we should measure it directly. So check out these videos on the FARA YouTube site, on FARA Twitter, on the FARA Facebook page, and on FARA LinkedIn. And until next time, we'll see you later.